Hi, Mr. Dente. Thank you for coming in.
Hey, Miss Mackenzie.
I wanted to talk to you about Clayton and go over his assessments with you about what we did. As you know, Clayton has been diagnosed with reactive attachment disorder. So before we get started, I wanted to talk to you about I need your consent to go ahead and place the video, send it for educational purposes. So I do want to get your consent for that. And what this says is that you authorize me to use the video for sessions and to discuss any sort of issues that we have with Clayton for his developmental and therapy needs. Okay. So I need your signature there on the line. All right, thank you so much. And then next, the first thing that you did for me was you did a RAD questionnaire. And the questionnaire, I'll go ahead and give you a copy so we can go through that. The first questionnaire that we did for Clayton, basically what it does is it asks you several questions, and there's 30. And what it does is it asks you 1 to 5 to rank your child for me on specific behaviors. For example, the first one, you said, my child acts overly cute and charming around others when he wants them to do things for him. And as you said, you circled a 5. Okay, and as you went through this, what it shows me is that Clayton scores 5s on the majority of this questionnaire. One of the ones that did concern me was that he is cruel to other children and also to animals. He scored a 5 on those. He does dangerous things and may hurt other people when doing them. These score very high. That means he does them frequently, and he doesn't seem to have a conscience or understand what's happening here. The other thing is you turn it to the back. My child likes to sneak things without permission, even though he knows he shouldn't do those. He scored a 5 on those. One of the things, my child doesn't seem to learn from his or her mistakes and behaviors. You scored a 5 on those. What we do is that we add these up, and then we subtract 30 from them because there's 30 questions, and then we rank them from high to low. Clayton scored very high. He scored a 98 on this scale. And what I do with this is I take this to our psychiatrist, and I review this with her, and as you know, we did already meet with her, and she was able to diagnose Clayton with reactive attachment disorder. And in addition to that, we used another scale system, and it was the behavior health status review.
And what is that?
Okay. This is a little more in-depth review. This was a basic questionnaire for us to get an idea of the behaviors you were seeing with Clayton or at home. And this one that we did was the behavior health status exam, and it went a little more in-depth. For example, we looked at his appearance. One of the things that children with reactive attachment do is they don't like to take care of their hygiene. They don't want to brush their teeth. They don't want to take showers, which is one of the things that you explained to me that he does. And he's unkept, he's unclean, and he has bizarre behaviors about that. One of the things that you did explain to me is that he likes to dump out the shampoo. He sprayed toothpaste all over the bathroom. So there's a lot of bizarre behaviors. He's not keeping himself clean, and so forth. So these are things that you have witnessed in the home. So these are things we talk about. The other one is we talk about motor skills. And so far, he was developing normally. He developed normally as a child, as an infant, so that's a positive. So we haven't seen any areas there. His speech was fine, but one of the things with RAD kids is they like to talk excessively. And I've been to your home several times so far, and Clayton definitely talks nonstop, and we call it gibberish. And he talks about nothing.
A story for everything.
Yes, he has a story for everything, exactly. So that's one of the markers we look at. It talks about sleep. We talk about content of thought. And one of the things on here he scored was lack of remorse. He's suspicious. He fabricates stories and very detailed stories about things that never happened. So these are all things that you have let me know that you see with him. Feelings of unreality, things that aren't real. He makes very elaborate stories. Somatic complaints. I did talk to the school, and he's in the nurse's office all the time. A headache, a stomach ache, his arm hurts, his back hurts. There's always a reason for him to be there. So these are all things that we've witnessed with him that you explained to me. So this form, the behavior health assessment, does go into a little more detail. It also talks about safety concerns with Clayton, and we have talked about that. We've talked about concerns in the home, and we talked about concerns around his friends. You have told me that he's been aggressive, and we did talk about that here. We do have concerns about that. You've explained to me that Clayton has made statements that he's not happy with his life. And, we've talked about preparing the home, removing items that he could hurt himself with. On my second visit, Clayton did express that he wanted to hurt himself. And you had told me that there was a knife in the home. And Clayton went and brought it to me. So that was a positive. So we're putting in those parameters in the house. And we talked about those things. We talked about those things with the psychiatrist. So safety is a big issue for us. And I've talked extensively with Clayton about that. And we're putting in those safeties. And I've talked to school about those so that there's safety mechanisms in place for Clayton. So that we ensure that he has places to go and people to talk to if he feels like that again. But yes, we need to prepare the house, make sure that things are put away, and that we're really aware if his behaviors start changing, he seems depressed, we can get him in to see the psychiatrist and work on those behaviors.
So are you only going to see him in home, or are you going to be at school too?
I will see him in both places.
Okay.
I have asked for increased hours for Clayton so that I can see him 2 hours twice a week, because he is scoring so high on these two scales that we can increase the therapy hours for Clayton.
Okay.
Okay. Are there any questions you have for me?
So where do we go from here? Where do we start, I guess?
Okay. What we do from here is I take both of these assessments, and you and I will sit down and we'll develop a treatment plan for Clayton. And what we do is I look at what we have here and how it's been scored, and we will identify the primary areas that we need to focus on the most to start with, and we will set up a treatment plan, and we will set goals for Clayton. And we'll do realistic things. It's not, you have to do 100% improvement today. That's not going to happen. And the reality is this is going to take a while. You've explained to me, and even through our assessments with the questionnaire sheet as well as the behavior health status exam, defiance is a big one for him. So we're going to go through here. You and I will set this up, and we will make realistic goals for him using these two assessments, and set the case plan and set some goals for him, and we'll monitor it every 6 months to see where he is, what we're progressing with, and where we need to focus on with therapy. You and I will work together. We will see a lot of each other. We will communicate. You will be involved in those sessions in the home. And we'll talk quite a bit on how he's doing, and we'll restructure things so we can move him forward in a positive manner.
All right.
Any other questions?
No.
All right. I know it's a lot,
Yeah.
but we will do this together, and we'll get through it.
Okay.
All right. It's all for the best of Clayton. All right. Well, thank you for coming in.
Thank you.
All right.